Hello and welcome. Thank you for tuning into Contegra Health's Coronavirus Update for the month of October. I am your host, Janee Carter, a family nurse practitioner currently serving the medical needs at Contegra Family Medicine Highland Clinic in Gastonia, North Carolina. Today, we are focusing on the similarities and differences among COVID-19 and the flu. Now, we know that there is a rise of concern in our community as we enter into this year's flu season in the middle of a COVID pandemic. Many are worried about how the viruses differ, and that gets a little tricky. So today, I'm here to provide a bit of insight on both viruses. So let's begin. COVID-19 and the flu. They are both very contagious viruses, respiratory illnesses, and they're caused by different viruses. So COVID is caused by the corona infection. Influenza or flu is caused by the influenza virus. And there are two types, type A and type B. Now, the signs and symptoms are very similar for COVID-19, such as fever or feeling chills, cough, shortness of breath or difficulty breathing, fatigue or feeling tired, sore throat. The symptoms can range anywhere from mild to very severe, runny nose, muscle pain or body aches, headaches. Some people experience nausea, vomiting, and diarrhea, but that's more common in children than adults. And some people have no symptoms, which is the asymptomatic, to actually being very severe in their symptoms. Now, what is the difference between COVID-19 and the flu? Well, COVID can tend to cause a change in the loss of taste or smell, but with the flu, none at all. How long before the symptoms expose themselves? Well, the similarity between COVID-19 and the flu is that 1 or more days can pass between a person becoming infected and when they begin to have symptoms. What is the difference? Well, with COVID-19, you can have symptoms 5 days after being infected, but the symptoms can appear as little as 2 days and as much as 14 days after the infection. So the time frame varies. Now, with the flu, you can start experiencing symptoms anywhere from 1 to 4 days after the infection. Now, in terms of the spread of the virus, what's similar about them? Both of the viruses can spread at least 1 day before experiencing any symptoms. What is the differences? Well, with COVID-19, it has a longer period of being contagious. The contagious symptoms can be 2 days before experiencing the signs and symptoms. You can be contagious up to 10 days after the signs and symptoms first appear, even if you're asymptomatic, which is the no symptoms, or the symptoms resolve after a positive COVID testing. Now, with the flu can be contagious for about 1 day before they show symptoms. Older children and adults are often more contagious during the initial 3 to 4 days and up to 7 days. Now, infants and people with weakened immune systems, they can be contagious even for a longer period of time. How does it spread? Well, there's similarities and there's differences. So in terms of the similarities, person to person, which is between people who are in close contact with one another, that's typically within 6 feet. They can be spread by droplets, so that's coughing, sneezing, or talking, which can land in someone's mouth, nose, or can be inhaled by others. And then there's contact, shaking hands, or touching surfaces with the virus on it, even such as touching your mouth, your nose, or your eyes. Now, what is the difference? Well, COVID is just more contagious. So the takeaway from our program today is to remember to try to maintain social distancing at least 6 feet. First clean and then disinfect your surfaces. Always wash your hands because washing hands helps prevent the spread of germs. And always wear your mask. Thank you for joining in to this month's presentation. And happy Halloween!